Thank you for joining us to discuss the project that you were involved in, titled Out of the Shadows, the Parkinson's Disease Report Card Program Sheds Light on Rural Community Need. This project was supported by a grant from the Parkinson's Foundation. We are very, very grateful. A little bit of history about how and why we decided to do this project and why your involvement was so important. We know that people living in rural areas have lower life expectancy, report worse self-related physical and mental health, and have higher rates of most chronic diseases and activity limitations. People with Parkinson's disease specifically tend to have better outcomes when care is managed by a movement disorder neurologist and with early referral to physical therapy. Yet in rural communities, less than 9% receive care from a specialist and only 20% receive therapy. Evidence suggests that tracking symptoms, follow-up monitoring, education can improve long-term activity levels and promote self-efficacy to implement the disease recommendations. Higher self-efficacy leads to better decision-making and self-care, more communication with health professionals, and better exercise adherence. People with Parkinson's disease with lower self-efficacy scores have worse motor and non-motor symptoms and quality of life. So what is this idea of self-efficacy? Because that was the central topic with this particular project that you were involved in. Self-efficacy is a person's belief in their ability to achieve a goal or complete a task, such as exercising more frequently or eating better. It's a measure of confidence in one's ability to control their behavior and their environment. Am I confident I can add one more day of exercise to my week to slow the progression of Parkinson's? Can I access an exercise class for me to meet that goal? Can I get to a class? Is there even an exercise class? So the integrated behavior model provided the framework for this program. In this particular framework, it states that to expect a person to initiate or improve behaviors related to better disease management, we have to address the person's self-efficacy to help make those changes. Research tells us that more frequent exercise, better diet, support services, and getting to specialists are so important in managing symptoms of Parkinson's disease better. Because specialized care can be challenging to access in rural communities, we came to your community to help bridge that gap. We hoped to improve a person's attitude and motivation, perception of how Parkinson's disease is managed, and personal agency by arming people with Parkinson's disease and your caregivers with the knowledge and skills to implement positive behavior change to manage your symptoms better. We really wanted to link this knowledge with what is essential to each person and the individual habits for better success in implementing changes in behavior. The program was an initiative designed to improve access to a specialist with Parkinson's disease expertise, to help you assist in monitoring the disease progression by all those outcome measures you did, and provide education and recommendations, as well as that follow-up support so that we can improve your self-efficacy and confidence that you could manage your Parkinson's disease better. If you recall, all of you completed 7 outcome measures 3 times over 1 year, about 6 months apart. We did this in Houghton, Mount Pleasant, Alpena, and Mount Pleasant. We monitored your walking abilities, your strength, your balance confidence, and non-motor symptoms, as well as your self-efficacy. If you recall, here is the ABC balance confidence. Here's the non-motor symptom questionnaire we had you fill out. You filled out the chronic disease self-efficacy scale. That was the big 33 item questionnaire. Looking at these pictures, maybe you can remember doing the 10-meter walk test, comfortable speed and fast speed. You walked backwards for 3 meters, and then we had you do 30 seconds sit to stand test. We also had you do a balance test, that brief best where you stood on a foam, you reached as far as you could, and then where we had you push into us and we let go, if you remember that test. Outcome measure scores were compared from one visit to the next. And here you can see kind of the general timeline for each of the locations. A report card summary was given to you for each visit, and then we gave you targeted recommendations that were provided. At the end of the program, most of you completed individual interviews so that we could understand what this report card program did for you, if anything. Here's an example so this should jog your memory of report cards. Hopefully you still have those and can give them to your physicians or physical therapists. So really what we were doing is trying to improve your self-efficacy and confidence to manage symptoms and to implement behaviors that would help you better manage Parkinson's when access to PD specialized care and service is often challenging. In the interviews, we wanted to know how this program impacted you and your ability to manage those symptoms, if at all. What did you think of the program? So 28 out of 37 people completed all the testing and interviews. In Mount Pleasant, we had 12, Alpena, we had 11, and Houghton, we had 5. We had 8 care partners join the interviews. The average time since diagnosis really had a wide range from less than 1 year to over 18. So the first thing we looked at were your scores on the 33-item chronic disease self-efficacy survey that you took. That was our big question. Did we improve your self-efficacy? Overall, you can see there were differences between the locations. We see that Mount Pleasant had higher average scores than Houghton and Alpena. We think this might be due to all the support provided by the physical therapy program and the interactions the program has within the community consistently. We have 2 Parkinson's disease specific exercise classes in person. We host the support group, and we have people with Parkinson's disease come to my classroom every single year. I also treat people with Parkinson's disease in the clinic, and so a PD specific therapist is more easily accessible in other locations. We also provide support to the Michigan Parkinson's Foundation, where the students provide exercise classes virtually every other Saturday. So then we looked to see if the scores significantly changed over the 1-year program. Did confidence improve? As that was our primary aim. Unfortunately, we did not see any statistically significant changes as measured by the Chronic Disease Self-Efficacy Survey. There are a few reasons this might be. First, the survey may not have been sensitive enough to measure small changes over time, and therefore the scores did not change significantly. Another reason we might not have seen change is because we didn't have enough time to see change. Parkinson's disease is a very complex disease. Understanding Parkinson's is a long process, and it's very individual to each person. It can really take years for someone to understand exactly what they need to help better manage their symptoms. If you live in an area without easy access to Parkinson's disease specialists, you may never get the support you need to best manage your symptoms. In the interviews, many of you told us you were diagnosed, given medications, and sent on your way without truly understanding Parkinson's or how to best implement strategies. Many of you were diagnosed by a primary care physician or a general neurologist who may have limited resources and knowledge about Parkinson's disease. Many of you have not seen a movement disorder specialist or been to a PT or other professional with expertise in Parkinson's disease to support you the best. The research supports what you told us. While we didn't see changes in self-efficacy, we did have some really interesting findings. People who had higher self-efficacy scores in our groups were linked to many of the outcomes we measured. So for example, those with higher self-efficacy scores also had higher confidence in abilities to perform daily activities that challenged your balance. Another way to put this is that people who believed they had good balance also had higher self-efficacy scores to manage Parkinson's disease. We also saw that people with higher self-efficacy scores were faster walkers on the 10-meter walk test, the self-selected speed. So that was the forward walking. In other words, if you walked faster forward, you had higher self-efficacy to manage your symptoms better. This also rang true for the backward walking test. We saw that people with higher self-efficacy scores were faster walkers going backwards. Again, if you walked faster backwards, you had higher self-efficacy to manage your symptoms. So we also found that people who are experiencing less of those non-motor symptoms as measured by the non-motor symptom questionnaire also had better self-efficacy. So if you had less struggles with non-motor symptoms such as can't sleep, urinary incontinence, erectile dysfunction, constipation, swallowing, the more of those symptoms that you had, the less self-efficacy you had. So people with better scores on balance and walking tests and with fewer non-motor symptoms felt more confident to manage their Parkinson's symptoms. So what does that mean? When Parkinson's disease symptoms really start impacting mobility and those non-motor symptoms, self-efficacy for managing those symptoms really does decline. People in rural communities need more consistent access to specialists like movement disorder specialists, the rehab services for the best management of the disease. Another key finding was that the tests related to fall risk and predicting fall risk did improve across the whole group. These changes were most notable between visit 1 and visit 2 because many of you took our recommendations to walk more, exercise more, see a physical therapist, follow up with a movement disorder specialist, and it showed up in the tests that predicted fall risk. Because falling is so prevalent in Parkinson's disease and can lead to more serious injury and functional decline, this is a huge victory for you in our group. That we saw that fall risk was reduced as a result of this program. So when you initiated our recommendations, you were able to reduce your fall risk. Again, more consistent specialized care in rural communities is needed to provide that support to you, especially as mobility and the impact of non-motor symptoms become more challenging. So again, we did these end of program interviews and we came up with 3 major themes. We're going to talk about each of them. The first one is benchmarking. You told us that the benchmarking or the monitoring every 6 months provided valuable insight into how you were managing your disease, which helped you understand whether you were progressing over time and if your behaviors were making a positive difference. Many of you expressed that having that measurable feedback, regardless of you improving or not between sessions, was preferable to not having any idea. This knowledge boosted your confidence and motivation and gave you a greater sense of control and hope. By identifying specific areas needing attention, you could focus on targeted strategies for symptom management, such as refining your exercise routines or adjusting your daily activities. Many of you expressed gratitude for the program, noting that it deepened your understanding of disease progression and reduced anxiety about the unknown. Care partners also reported increased confidence in knowing how best to support you. Caregivers noted positive changes in your mood, your outlook, your physical performance between testing session, which really reinforced our program's impact. Even when you, as a person with Parkinson's disease, did not always recognize your improvements, your care partner did. And here's some quotes. The second theme that we saw was the power of information from trustworthy sources was highly valued. Many of you expressed the frustration and disappointment with the level of care you had previously received, including the lack of information about your diagnosis and treatment of alternatives other than just getting medications. You voiced how you were given a sense of comfort and hope in managing the symptoms, citing that the compassion and empathy displayed by our team enhanced your willingness to participate and be consistent with using the interventions. You appreciated that we presented research-based interventions, which helped you employ new behaviors with less hesitation. I just think this middle quote that somebody cared about us speaks so strongly to how many of you felt that yes, our team did care about every single one of you and how well you were living with Parkinson's disease. Your views, the third theme was looking at your views about accessing specialized care. Your views on access to healthcare varied significantly across the 3 locations. Some recognized that your community lacks specialized care, highlighting a very significant service gap. Others of you acknowledged the long distance required to access care, but did not perceive it as a challenge, as it aligned with what you have always known by living in a rural community. You have to drive to get someplace. In the end, many of you voiced disappointment that the program was ending, highlighting that it was the only resources you trusted to support your Parkinson's journey. And I think these quotes also really highlight you taking a day off work, a 300-mile trip, trying to get me to drive down several times a week, and that's impossible. We don't have enough medical and physical therapy care up here as we should. So living in a rural community while managing a progressive disease like Parkinson's disease is really a balancing act. The ideal situation is when an individual has high self-efficacy in seeking out the resources and the health care services they need to manage optimally. When trusted healthcare providers are readily available and accessible in the community, it becomes easier to provide benchmarking, monitoring, and consistent follow-up care for a person with Parkinson's disease needs. In a perfect world, there is a balance where an individual and or the care partner can consistently rely on these external sources, the self and the healthcare services, as they seek them out to support them in their journey. A person or their care partner can have very high self-efficacy in seeking out the support services they need. But if the experts are not embedded in the community, the individual or caregiver will have a heavier burden to access, use, and get to the specialized care, which is often 100 miles away. So the burden becomes more on the individual to seek out those healthcare services. As symptoms of Parkinson's disease become more pronounced, such as cognition, motivation, mobility, lower self-efficacy, and caregiver burden, there is a lower ability to seek out those expert support services. When the expert care is not easily accessible in the community, people with Parkinson's disease living in rural areas can really struggle to effectively manage the disease process. Sadly, we saw several of our participants fall in the shadows of the healthcare system. This is not okay. People living with Parkinson's disease need the right people embedded in the community to enhance access to specialized care, which can strengthen an individual's ability to walk out of that Parkinson's disease shadow. We attempted in this activity to provide expert care in this program, and we had some really good results. But you need more consistency, more support, more monitoring. You need experts embedded in the community all the time to support you in the long-term management of this disease. I would love to see a program like this expand to include a whole team of people who visit more regularly. Or could this strategy tap into the local resources through training or initiatives to offer similar programs right in the community to provide that focused, individualized, and consistent specialized care? Ultimately, changing access to specialized care in rural communities requires top organizational commitments and reform from federal and state programs, hospital systems, and policymakers to address the disparities in accessing specialized care for people with Parkinson's disease in rural areas. As Johann Wolfgang von Goethe wrote, "There is strong shadow where there is much light." We must find the light for you. Your participation in this program highlights the need to improve access to expert care for people in rural communities. We cannot thank you enough for your support of this program. We hope to publish our findings soon and get the attention of those who truly have the power to make the changes necessary for you to live well with Parkinson's disease, even while living in a rural community. Thank you. Of course, I must thank our student team for their unwavering commitment to this program and to all of you. I could not have done this without them. They learned so much about you and the challenges you face as a person with Parkinson's disease living in a rural community. If you have questions, please don't hesitate to contact me. When our results are published, we will send those documents to you both in hard copy and email. So again, I thank you for your support.